Olympics beginning on Thursday. Thank you for watching, everyone. I'm Lester Holt. Please take care of yourself and each other. Good night.
The Meet the Press.
It seems like common sense. If you work in a hospital where people are sick, you should be vaccinated for COVID. Thing is, in Oregon, state law says hospitals can't require that.
We are looking at every option that we can to increase vaccination rates for healthcare workers.
And speaking of vaccine mandates, you might start seeing more of those after the FDA grants full approval for the shots. Also, if you're wondering just how big the Bootleg Fire in Southern Oregon has gotten, not only is it the largest fire in the country right now, but it's also bigger than Los Angeles, twice the size of New York City. Here's the story.
Hi, I'm here for the story. This is the story? Well, I'm in the right place. Thanks for being with us. I'm Dan Haggerty. All the ways to communicate with us, which is what we want you to do. Tell us what's on your mind, how we're covering the news. Are we covering it the way you want to see it covered? Are we covering the topics that you're interested in? Email me at thestory@kgw.com or hop on Twitter and use that hashtag #HeyDan. Now, I want to start tonight talking once again about the low vaccination rates among healthcare workers in some parts of Oregon. This has been something people have been interested in discussing, a little confusing for some people. So people think, why don't hospitals just, maybe require their employees to be vaccinated? But by law, they can't, even though schools, businesses, and pretty much any other employer can. Here's Kristen Severance.
Hospitals in Oregon can't require doctors, nurses, or any of their employees to be vaccinated. It's been this way since 1989, when a law was passed stating a worker shall not be required as a condition of work to be immunized under this section. That goes for everything from the flu shot to the COVID-19 vaccination. And while 87% of medical doctors in Oregon have at least one COVID-19 shot, other groups have a much lower percentage. 43% of certified nursing assistants have not received a COVID vaccine. And as we learned last week, vaccination rates among healthcare workers in Oregon varies widely depending on where they work. In Washington and Benton counties, more than 80% of healthcare workers are at least partially vaccinated. But in Eastern Oregon, the rates are much lower. In Harney County, 57% of healthcare workers are unvaccinated. The Oregon Association of Hospitals and Health Systems said it's long overdue for a rule change. Dave Northfield is a spokesman for OAHHS.
We believe that it's important for hospitals to have that tool during a pandemic. Not that they all would, but just to have that option to require staffs to be vaccinated during a pandemic. We just think it's really important to have that local option.
While they don't want a statewide mandate, they do want hospitals to have the choice.
We believe that the state could write a rule that gives individual hospitals local control to institute a mandate that falls short of a statewide mandate.
But the Oregon Health Authority says the change to allow hospitals to decide would have to come from the legislature. Spokesman Rob Cowie said the OHA could pass a statewide mandate, but they have not been asked to discuss it.
We're absolutely open to it, and we're not at that point yet. No organization has asked us to issue that rule. The other route would be through the state legislature. So I think that there are some steps that would need to occur before we would get to that point. But the health authority is open to increasing vaccination rates and using every tool we can to get there.
One group against a rule or law change, the Nurses Union. The Oregon Nurses Association told us, quote, "We are not currently seeking a change in Oregon's statutes regarding workplace immunizations. We believe there is much more work corporations can do to protect workers and increase vaccination rates before they begin firing Oregonians during a pandemic." KGW investigates could not find any other state with a law that prohibits hospitals from requiring vaccines for their employees. I'm Kristen Severance, KGW News.
Now, speaking of vaccines, why don't we count some right now? More than 2.52 million Oregonians have gotten at least their first dose. That's according to the CDC. It works out to be nearly 60%, 59.9, we're right on the door to 60% of people in this state with at least one shot. And that includes kids and adults. Even though I know kids under 12 aren't eligible to get the vaccine yet, we wanted to give you an idea of how much of our total population has at least one shot. In Washington, more than 4.79 million people have gotten at least their first dose, according to the CDC. That works out to be about 63% of that state's entire population. And I know a lot of you still have questions about the vaccine, like this one we got from DJ. DJ asked me, hey, Dan, some people are using the not yet fully approved by the FDA as a reason for waiting to get the COVID-19 vaccination. So where is the FDA in giving full approval? What is creating the delay? So first of all, thank you for the question. Appreciate it. And DJ is right. These vaccines have been in that emergency use authorization category since the first shot, really. And there have been people waiting for it to get full approval, I think, before feeling comfortable enough to get it, though I don't know that's a very big population. First, I should say this. The difference between those two categories is mostly about production. It's not necessarily about the vaccine safety, though that is a part of it. You see, normally a company does all the testing first before they spend a ton of money on the production. But with something like a COVID vaccine, companies took the risk of doing the testing and production at the same time, then applied for that emergency use authorization. Typically, companies don't start producing millions of doses of something until it gets approved. This was different, though. I will say, at this point, with millions of people vaccinated already, we know probably more about these vaccines than we ever would have learned in a standard testing phase, according to what I've been reading. But none of that really matters, because the recent polling doesn't show a large amount of people waiting for the full FDA approval to get this vaccine. Right now, according to the studies, the people who don't have the shot don't want the shot, for the most part. And it's easier to avoid the vaccine before it's fully approved. See, according to reporters at NBC News, vaccine mandates are more likely once the FDA grants full approvals. Right now, it's one of the biggest hurdles for companies or government agencies that want to mandate the vaccine. On Friday, Pfizer said they expect to be fully approved by January of 2022 at the latest, and the FDA director commented on this and said a decision actually should come before then. And once the vaccines are fully approved, companies will be inspired, or at least more inspired, to put in these mandates. It's controversial, yes, but what is not controversial nowadays? In Houston, a judge dismissed a lawsuit from hospital employees over vaccinations. A bunch of them quit or they got fired because they wouldn't get the shot. The judge in Texas sided with the hospital, but Oregon and Texas are two very different places. Now, we've talked about this before, and in Oregon, your boss could try to force you to get vaccinated, but the laws here make it quite easy, actually, to be exempt from mandatory vaccinations. You use a pretty liberal medical, religious, or philosophical exemption. But companies will have slightly more power in the argument once the vaccines reach full approval. Now, let's get to our big story, which is about the biggest wildfire in the country right now. The Bootleg Fire in southern Oregon has burned more than 388,000 acres, and it's still growing. To add a little context, that is big. It's bigger than the city of Portland. It's more land even than all of Multnomah County, if you want to talk about acreage. That also makes it the fourth largest wildfire in modern Oregon history, at least going back 100 years or so. The Long Draw Fire in 2012 burned more than 500,000 acres in rural southeast Oregon, followed by the Biscuit Fire in 2002 in southwest Oregon, and the Buzzard Complex Fire in 2014 near Burns. Now, the Bootleg Fire is quickly climbing the all-time ranks right now. It's also larger than any fire that burned in Oregon during all of last year's devastating fires that we experienced, which seems a little strange to hear, I'm sure, since, we lost people, we lost homes. It was terrible. A lot of us were in this cloud of smoke for a week. The difference is last year's fires may not have been as big in terms of acreage, but they were really close to heavily populated areas, and it even burned down entire towns like Detroit and Talent. The Bootleg Fire is really in a rural area where, yes, people do live. I don't want to give you that misconception. There are people living there, but there aren't the same size of population like towns around in that area. You might be familiar, probably the closest name town you might have heard of, Klamath Falls, which is about an hour away from the fire lines. Of course, I'm not talking to people who live down in that area, who certainly know that very well, but that doesn't mean that we should ignore what's happening just because it's not heavily populated. Maggie Vespa is on her way to the fire to cover it for us, and we wanted to check in with her now.
Hey Dan, and hey everybody at home. I'm Maggie Vespa. I'm right now in Oak Ridge, Oregon. I just pulled off of Highway 58. I'm on my way to Bly right now to talk to a man I interviewed last week. His name is Tim, and he lives near Bly. And he and his wife last week had just found out that the Bootleg Fire had burned all of their possessions, all of their belongings, a lot of cherished items that had all been packed up in trailers, and they had left it on their property when they fled the fire, as they could see it chasing them in their rearview mirror. Miraculously, their house, which was under construction at the time, actually survived the fire. They felt really lucky about that, but still they were daunted by everything that burned. Fast forward to this morning, I talked to both of them on the phone, and they told me that they're back at their house. They're literally sifting through the ashes, and they're also running around their neighborhood, putting out hot spots with their own garden hose. And if you think about it, that kind of makes sense, because we know there aren't enough firefighters to fight the Bootleg Fire, as well as all the other wildfires burning in our state and across the West. There definitely then aren't enough firefighters to stay behind and just put out hotspots in areas that have already burned. So it's kind of left to residents to do that. So again, I'm headed to talk to them tonight. We're going to have their story throughout the day tomorrow, also at kgw.com. And of course, we'll bring you updates here on the story, just basically showing you firsthand the impact of the Bootleg wildfire. I'll send it back to you.
All right, Maggie is a good person to have down there. She'll keep us informed. Chief Meteorologist Matt Zaffino joining us now. Something that caught my eye in the press release about the Bootleg Fire. It wasn't something I expected to read about. It had to do with beetles.
Yeah.
I wanted to know if you could give us some context to that.
You know, there are forests in Oregon. You can see one on the drive up to Mount Hood that have been killed by bark beetles and pine beetles and other beetles. And what happens is these infestations of beetles, the beetles go in, and if they're not stopped, they literally destroy and kill a forest. They get under the bark and they kill the tree. Now, the beetles are able to do that better when there's a drought, because when there's a drought, the trees produce less sap. Sap is one of the tree's defenses against beetles, and when they don't have the moisture, they can't produce as much sap, and so they're more susceptible to beetle kill. One such area is within the grips of the Bootleg Fire. This is a map from the folks at the Forest Service, and the fire manager showing the Bootleg Fire in the pink here, and then the surrounding land here in the yellow and in the green. But what I'm focused on is this area right here. You see how it's labeled the Gearhart Mountain Wilderness right here straddling the Klamath and Lake County border? That has a big area of beetle kill. That is a forest that was infested with beetles. The beetles then killed the trees. The trees are now dead. Forest fires, of course, love dead trees. So this is one of the areas of concern with the fire managers down on the Bootleg Fire, is this area of beetle kill. Now, in some ways, there have been some studies that suggest, hey, beetle-killed forests are not really as bad because they don't have the foliage that can burn, and so they don't burn quite the same way. But there's a lot of dead wood in there, and a big hot fire like this, it'll eat up that dead wood in the beetle-killed area. So that is one of the areas of concern and focus for the fire managers on the Bootleg Fire itself. It really is something that they are working on and have been mentioning in their reports day after day. So a little bit more context for you on the fires. Hotter years, more fires. This is from our friends at Climate Central. Large fires across the West. Since 1980, you see there's a lot of variation. That's what these individual bars are. Some years are low years, other years are big years. But the overall trend has been to see those increase from about 48 large fires, that's 1,000 acres or bigger, to 50 large fires. And that only goes to 2017. In the last 4 years, we've had a lot of big fires. So basically, since the 70s, it breaks down this way. Fire season is 105 days longer in the West. It burns 6 times as many acres as it did back in the 1970s, and 3 times as many large fires. Again, fires bigger than 1,000 acres. Now, this isn't all related to climate change. There's a lot of reasons that this is the case, some of which are fire management or forest management practices. But with a warmer climate, that's certainly part of the equation here. And in fact, looking ahead to the year 2050, if you look at the top climate hazards here in the West, notice they're orange, they're red, or they're blue. Those are all warming or drought, heat, and water deficits, which of course are no friends to wildfires. Dan, back to you.
Good context. Matt, thank you so much. We do want to talk about, I don't know, probably the worst tweet of the day. What do you see in this picture? Just curious as you take a look. Do you see a massive wildfire painting a hellscape across the sky? That's what I see. But the Oregon State Police saw the perfect backdrop to win a beauty pageant for government vehicles. I know the premise is almost too strange to understand. Let me explain. This morning, OSP tweeted out this picture and asked Twitter, cast your vote for Oregon as the 2021 best-looking cruiser. It's a weird choice. It is, considering the state is currently battling massive wildfires while still recovering from last year's awful fire season. Obviously, they got a little bit of criticism for this online. Online loves to do that. So they added, we know that this photo was captured during a devastating time for Oregon. However, it also represents our great state's perseverance and teamwork. I really considered making a joke here and putting up some made-up competition where we were asking for your support as I waved in front of an image of the Hindenburg exploding or something, but we decided against it. All right, we're going to take the high road because I appreciate OSP. I really do. The work that they do, they are out at those fires. That's why they could take that picture, okay? Because they were out there helping people to stay safe from the wildfires. But just a little bit of advice for optics' sake, as somebody who's in front of the camera, especially as you defend the tweet. In my industry, if a reporter, for instance, covers a tragic story and posts a smiling selfie from the scene, we typically call them on that because it's a bad look, especially for someone trying to win Best Looking Cruiser.
So, you've trained your entire life to compete in the Olympics. You finally made it to Tokyo after a year delay and a 12-hour flight. And waiting for you in your room is a bed made out of cardboard. I'm getting some real Fire Festival vibes. We've got an Olympics update for you when the story continues.
Welcome back. Going through your emails and your comments using the hashtag HeyDan. We'll comment on a few at the end of the show. We also want to remind you about our Hey Help campaign this week. We are asking you to consider donating to the Northwest Association for Blind Athletes. They help more than 1,900 kids and adults participate in sports and other physical activity. If you'd like to donate, just open the camera on your phone, point it at the QR code on your screen, or go to kgw.com/heyhelp. Now, every time the Olympics happens, there's usually some issues on getting it off the ground, right? It's the biggest sporting event in the world, which is already a lot to pull off, but now they're trying to do it in the middle of a pandemic, and we're only a few days away from the start of the games, if they happen. They could actually be canceled still at this point. Up to the very last minute we could hear about it. The CEO of Tokyo 2020 today said that he'll discuss accordingly if there's a sudden surge in COVID cases, for instance, in Japan. Tokyo reported more than 1,300 new cases just today. That's the second highest daily increase since January. But let's take a look at some of the other Olympic drama. In our new segment, This Is Fine. A Team USA swimmer in the Paralympics decided to withdraw from the Games. Becca Myers won 3 gold medals in the Paralympics in Rio in 2016. But she said when she was there, it was pretty hard for her to get around on her own. And she had been planning on bringing her mom to Tokyo to help her as a personal care assistant. Olympics officials told her, can't do that. No, there's no room for extra personnel, and that only athletes and essential staff are allowed. So instead of dealing with her immense personal challenge, without her mom by her side, the gold medalist decided to skip the Games. This is fine. Meantime, the athletes going to Tokyo are going to be sleeping in cardboard beds. Imagine getting off your flight, 12 hours, you're in Tokyo, you flop onto a cardboard bed. Okay. A runner speculated they were making cardboard to keep athletes from having sex on them, thinking that they wouldn't be strong enough. Okay, turns out that's not the case. Officials say they're actually stronger than wooden beds, but they're made of cardboard so they can be recycled after the games are over. That's what a world-class athlete competing at the heights of their athletic abilities want to sleep on, a cardboard bed. Doesn't matter. This is fine. Speaking of athletes hooking up, Olympic organizers are handing out hundreds of thousands of condoms at the Games, but they're telling athletes not to use them. I mean, they're saying use them, but don't be in a position to use them. Well, you know what I mean. Athletes are being told to avoid unnecessary contact, to limit the spread of COVID, but organizers are still expected to hand out 160,000 condoms with the Olympics logo on them for some reason. They're telling the athletes not to use them in the Olympic Village and to wait until after they get home. But at that point, they're going to be collector's items, so who knows what to do at this point. One thing they're not providing, masks during a global pandemic. It's a BYO mask situation there. Again, plenty of condoms to go around. This is fine. And we got a question for a viewer about this story. A beach handball team from Norway was fined because they wanted to wear shorts for their competition instead of bikini bottoms. This actually happened in the European Beach Handball Championships, not the Olympics, but we'll add it in here for fun. The International Handball Federation requires women to compete in bikini bottoms, again, for some reason. Men are allowed to compete in shorts. Again, this is fine. This is fine. Now, speaking of the Olympics, viewer Janet wanted to know why Japan's vaccine rates have been so low and are so low right now ahead of the Games. Like we told you last night, only 22% of people in Japan are fully vaccinated right now. And Janet asked, they've had over 5 months to get people fully vaccinated in Tokyo for the Olympics. Why have only 22% of the Japanese people been fully vaccinated? Why doesn't the Japanese government use the U.S. military station there to help vaccinate people? So there are 2 main reasons for this. First is that Japan doesn't make the COVID vaccine in Japan, so they have to wait for it to be imported. The other is that the vaccine rollout works differently in Japan than what we're used to here in the U.S. We went to Professor Ken Ruoff to learn more today. He's the director of the Center for Japanese Studies at Portland State. He says Japan requires, first of all, more specific testing for the COVID vaccines because they are made in another country.
It's quite a bureaucratic place. All experts on Japan recognize that, and many people who've been to Japan have experienced that firsthand. And so in order to approve, for example, the Pfizer vaccine, they required the tests be done specifically on Japanese citizens rather than accepting the results of tests done on people elsewhere. So that, first and foremost, delayed the overall vaccine rollout.
Also, under Japanese law, only doctors and nurses are allowed to give vaccines. So to go back to Janet's question for a moment, the U.S. military in Japan legally there cannot help vaccinate people in the way that they do here in the U.S. And right now, Japan has a national shortage of medical workers, and that started even before the pandemic. All right, keep sending in your questions and comments with the hashtag HeyDan. I'm going to read a few and share some news after the break. All right, hey, I'm just looking through a couple comments. Let me pull a few up. Keep using that hashtag HeyDan. First of all, Darla wrote in and said, dude, get over your bad self. The cardboard beds, there are 18,000 of them. The cardboard is the frame. You just put a mattress on it. Do you not sleep on a mattress? Or just on the frame? Darla, you're correct. Those Olympic athletes, they have cardboard frames, not cardboard beds. They do get mattresses. So thank you. You're right. Thank you for calling me on that. Also, Josh wrote in and said, why do you show us a shot of a stethoscope when describing a doctor? Then you showed a picture of a female nurse to describe other healthcare workers. That seems rather unfair, Josh. I couldn't agree more. And just to set the record straight, not all doctors are stethoscopes. Real quick, I just wanted to share some personal news before we go. My time with KGW and on this show will soon come to an end. So my family, we are going to be headed back east to be closer to our families. I know this might come as a surprise to some of you, but I'm sure you understand how COVID has changed our lives and the way we see our lives and kind of what we prioritize as most important. Now, this isn't my last show. Don't be sad or start to celebrate just yet. You're still going to have to put up with me for a little while longer, a couple more months. You can find more details if you're interested in the details. You might be already changing the channel, but if you're interested, we have more details on my Instagram and Facebook page. I put up a post today. And just so you know, the show, the story, isn't going anywhere. And as you already know, I am just one person on a great team with great support that starts at the top of KGW and of this company. So nothing changes with the story. This was never my show. This has always been and will continue to be your show. If you have any questions about how this is all going to go or anything about my life, you know I've always been pretty much an open book. You know how to find me. That's a Tuesday. I'll see you back here tomorrow. Have a good night. That's the story.